All righty, the floor is yours.
Thanks, Julianne. I'll call the meeting to order at 5:32. And do we have an approval for the minutes from December?
I move we accept those minutes.
I'll second.
All in favor?
Aye.
Aye.
Is there a motion to approve the checklist and financial statements from December, or any questions or concerns?
I have a question. If I can find it. Can you, Dina, do you know why 3 times in the checklist it gives a QuickBooks? It just says QuickBooks and then we can't see, and then it says created by pay split. And it gives like $8,157. What?
I'm guessing that is part of the taxes and payroll, just all of the wages and everything. I'm not really
Okay.
sure why that's showing up. I can see if he can do an amended report, but I think what he's just doing is this is just the check register,
Oh,
QuickBooks.
Okay.
It's everything. It's payroll and
every time he balances it or something, or maybe it is payroll because it's 12/3,
It's your total.
12/15.
Yeah, it's your total payroll for that period,
Oh, okay.
Yeah.
payroll and taxes,
it looks a little bit different than what we're used to.
right?
Yeah, I don't think our checklist usually includes payroll, does it? It does, or it doesn't usually show, list the names like this.
It does it. So I think that I don't know if he's limited in what he can put together. What he does is he sends me an Excel spreadsheet of all of the reports in them. And I don't know if he can put just a checklist in that Excel spreadsheet. But for him, it's easier, I think, just to say, okay, here's the check register. And I can put it in that Excel spreadsheet and it goes to me, and rather than having to download separate files and things, it automatically generates it for him.
Any other questions or concerns on the checklist or financial statement?
I make a motion that we approve them as presented.
I'll
I'll
second.
second it.
Okay, I had 2. Keith and who? Michelle?
Yeah, you can just give it to him.
All in favor?
Aye.
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 The accounting updates, Dina?
Yeah, so it looks like our accountant, Kelly Gamble, is on top of things, and W-9s and W-2s were mailed out and handed to staff members, and all of our other state tax forms were prepared and filed, as well as our federal tax form 941. So pretty confident that things are getting done in that area. So you want me to go ahead? Just go ahead.
Yeah. Yep.
I almost called you Aunt Hannah. Your name on your phone's Aunt Hannah.
Is it Aunt Hannah? Oh, that's weird. I don't think I've ever. Oh, my mom did a Zoom baby shower for my sister. That's why it says Aunt Hannah, and that's the last time I used my phone for Zoom. That's
Great.
Sorry, guys.
There's items there listed from the KDLA month report. I'm just quickly skim over there. There is another conference coming up in March, and staff members can propose a session. The link is there in the document for you guys. And then also more information can be found about the conference at the links provided in your document. There is this training is actually passed. There's a training for mandated reporting as a public librarian in Kentucky. It's going to be recorded, and we have several staff members that will be taking this. It's regarding if we see any neglect or abuse with a child that comes into the library, what our responsibilities are. Library Legislative Day is usually February 11th. That has been canceled for in-person visits. And so we're going to try to come up with some different ways that we can reach out to our legislators this year. Betsy's going to present some ways to the staff that we can get them involved as well. So, and then there's some ideas on how to connect with KDLA through social media. There's different departments and categories. If you're interested in those, there's a list of social media venues there, Instagram and Twitter and SoundCloud, some that I haven't even heard about yet. So if you want to interested in library topics, please join them on social media. So our we're doing pretty well as far as library services are concerned and staff. After the break, we were all pretty anxious to go ahead and get opened up and start services again. So on January 4th, we reopened for in-person services Monday through Friday, 12 to 6, and still with that limited number of people in the building. So we have no more than 10 people, and that really hasn't been too hard to really police. You know, we're not having a lot of people coming in all at the same time. Have about 5 staff members coming in the building at a time and still working in teams. We did have 1 staff member that tested positive this week, and they are recovering at home. We don't feel like any other staff member was exposed, so we haven't required anybody else to quarantine. So, and then we're just meeting with staff members through Zoom and social distanced in-person meetings to go over new goals for this next year, and been having a lot of department meetings with collection development and technology and programming to make sure that we're all on the same page for this upcoming year. So we've been pretty busy for January. Somebody have any questions about staff or hours?
One that was positive, are they asymptomatic or are they doing okay?
I haven't checked in today. Yesterday they're feeling pretty rough, so no, they've had some unpleasant symptoms with it. So, Michelle, did you have a question?
No, I was just changing my screen.
Okay. We are checking in on him though. We've got some care packages and things going their direction this next week or two from other staff members. So we're trying to take care of them. So policy, each of you should have gotten an ethics policy in your packet to review, to read and sign. And there should be an envelope in there. If you could put it in that envelope once you read it and sign it and put it in the mail. I'll just keep it here in a file for to keep track of it all. You also should have signed or received the Open Records and Open Meeting Acts guidelines. If you didn't, let me know and I will make sure I get that to you in your next board packet. There should be a receipt form attached to that. And if you fill that out and return that to the library as well, we have to show record that you guys have actually received a copy of that. So I don't know how many changes have been made to it. I have not had a chance to review that, but I'm going to go over that this next week and make sure that I'm up to speed on all the new regulations and laws concerning that. Again, it's not very pleasant read, not very entertaining. So if you got insomnia and you needed help, that's a great sleep aid. So I was hoping to present our circulation policy this month, but I feel like we had too much to go over. So next month I have it already. We're going to go over the circulation policy that will include the guidelines to help us circulate laptops and hotspots. And hopefully that won't take too long. Hopefully it won't be too painful for us. So we also need to talk about and make some decisions regarding the vaccine. I checked with our KDLA, and it looks like libraries and archives are scheduled to, it's like 1D, I think. So we are in that first group of people that are available for vaccines after teachers and first responders and such. So we need to probably set expectations for staff members regarding that. Just talking to other libraries, I have yet to come across any library that is requiring that, the vaccine. And if we do choose to require that, we probably need to talk to a lawyer and create a policy on that. So I would recommend that we just encourage staff members to have it, but not require it. But what are your thoughts?
I agree.
I don't think you can require it anywhere. I mean, ours, when it came out, it was like if you are offered it and you don't take it, then you may not be able to participate in the pay that they have set aside for COVID relations. But in other words, you would have to take your own time.
I thought about that. You work in the HR department, right, Michelle?
Pretty much.
And is that allowable, like to limit sick leave if they're not going to take the vaccine?
Well, it's not in the contract. We're union, so it's not in the contract that they have to get paid. They've just been paying them out of the kindness of their hearts. But they set aside a special number to charge that to if they do have COVID or if they're off because they've been exposed and quarantined. But you cannot make it mandatory. You can just say and I mean, my daughter works in the hospital and she's 36 weeks pregnant. So she did not take it because of there's not enough data on pregnancy yet. And she got a notice that if they don't take it and they get it after February 1st, they have to take their own sick time as well. But otherwise, I think they have some kind of furlough pay as well. So I think that's a very gray area on, what we decide to do on paying them is one thing, but I don't think you can mandate it.
Yeah. So are you guys okay with that, not making a mandate?
Yes.
Yes.
Yes, very
Let's,
much.
okay, let's go ahead and make a motion then.
I'll make a motion to not require staff to receive the COVID vaccine.
Second.
I second.
I put Doug down as a second. Is that okay, Pam?
That's fine.
Okay.
All in favor?
All right.
Aye.
Okay, so I didn't really consider this before I set these notes up, but do you have any stipulations on that? So if they're not going to get vaccinated, do you want to require them to use their own sick leave?
What are we doing now?
We have nothing in place right now. We don't have any vaccination policy.
But have we,
think that
Right now, and that's the thing.
That's the next thing on the list, isn't it?
Yeah, so the COVID benefits, that the emergency paid leave and the emergency FMLA, that expired the end of December. So that's something we need to make a decision on. Do we want to extend one or both of those benefits? And if so, in order to qualify for those benefits, are you going to say, hey, you need to be vaccinated?
but you're saying the emergency paid sick leave, was that our policy or is there something money coming from the government?
So the emergency paid sick leave was a federal law that required us to pay 80 hours of, well, we weren't quite required to do that because we were so small, but we decided as a board to go ahead and offer that.
Okay.
Those protections are expired the end of December. We didn't really put anything in writing other than we would follow the federal guidelines for this. So, libraries are handling this differently. Some of them are saying, okay, let's keep these policies in place until the end of January and revisiting it every month. Oldham County, they last spring just said, okay, regardless of what happens, every staff member will get 80 hours, up to 80 hours of COVID leave pay if they get sick. For part-time staff, that would be 40. So there's
But the federal was paying that.
no,
They were reimbursing us or no?
no, there was a tax
No.
incentive. There was a tax incentive for companies to participate in that program. Well, that doesn't really apply to us because we don't pay taxes.
Okay.
Yeah.
I think that if we don't, this is just my opinion, if we don't offer to pay them, taking the vaccine out for just a second, we're just setting ourselves up for people wanting to come in sick that need the money. So highly encouraging them to take the vaccine when it becomes available.
Yeah, I agree. We only have.
What do you mean? What do you mean sick? Like just taking this and saying they have COVID, or what? You wouldn't require a positive test, or
Well,
they
what
try
we
and get
do
sick
is,
to get the pay?
if you have a sore throat or any sinus symptoms, any of the symptoms that COVID has, if you have any of those, you're asked to stay home, tell your manager or supervisor, and they report it and they send you to be tested.
Yeah,
So, I mean, would they not receive this pay unless it was a positive result? I mean, if it came back negative, I mean, they wouldn't receive this pay.
If they came back negative, then they return to work.
Yeah, and they wouldn't receive the pay. I guess I'm just saying if we pass this, they would have to have some kind of proof that yes, they have COVID in order to receive this pay. Otherwise, it's your sick day.
So how I handled it this last year was if there was, because there's like one staff member had a 5-day wait for a lab test to come back. That's 5 days of their, and we required that they go get a lab test. So what I've been doing is I've just been tracking those hours. Like, okay, so this staff member, say she was only able to work, or he was only able to work 20 hours at home. So I tracked, okay, there's 20 hours of COVID sick leave. So I've been tracking that. So that they would potentially get up to 80 hours. So once that 80 hours was expired, then they would have to start using their own sick leave. Does that make sense?
Mm-hmm.
And it's been difficult because, like Michelle said, there's times when we require them to quarantine.
Mm-hmm.
And then we could, a person could be quarantined 3 or 4 times for 14 days at a time. So-
Because their mother that they went to their house has it, or their husband has it, or they would have to be quarantined.
Luckily, our full-time staff, it's pretty easy for them to work from home, so they're not cutting into those hours. For part-time staff, it's not so easy when their job is at the front desk. So, I mean, I would recommend continuing the 80-hour sick leave. We could do that, just blanket indefinitely until this mess is, they get 2 hours COVID sick leave period. And perhaps we can put a date on it by, June 30th. This will be in effect. I prefer not to do it month to month. It's just a hassle. But what are you guys' thoughts?
But you're not talking about the vaccine still, right?
No, we're gonna leave that complicates thing. Let's stick with the 80 hours sick leave. Do we want to continue to offer that benefit?
My vote would be yes.
Could we vote yes on that for, say, 6 months at a time? Would that be advantageous?
We could do that. Put a date like the end of the fiscal year is June 30th.
I don't know if there's any benefit to that. Let me just rescind that. Forget that 6 months.
I think this is gonna be a mess for another year, guys.
Yeah.
Even with getting the vaccination, we're still gonna have to mask up and clean and everything, and there's still gonna be exposures. You can still get sick with it even if you have the vaccine. So,
And if you do have the vaccine, you can certainly become sick with it. So, it's, there you are.
Yeah, the
So
sources. Go ahead, Pam.
I mean, I'm for continuing it as you suggested, Dina, until June the 30th. And then we'll reevaluate at that time.
I'd be in favor of that also, and I'd also be in favor of when it comes up again, the 1st of July or the end of June, extending it for 6 more months. But after that, it appears to me that everybody after about 11 months of this ought to have the opportunity to get the COVID vaccination. And when January the 1st of 2022 rolls around, if they haven't gotten the vaccination and they get COVID, they're on their own. Because this is not going to be over by December the 31st of 2021.
yeah, I agree.
So, I think that people who are not inclined to get vaccinated, or if there's a possibility that the vaccine's not going to be available for all them to get vaccinated, that's another issue. But if they're inclined not to be vaccinated, they need to be doing some serious soul searching about what's going to happen at the end of the year with respect to leave if they get it. 11 months advance notice ought to be a big plenty for anybody.
Yeah, I do understand that there are some people who are concerned about the effects of the vaccine and how it's going to affect them, but I don't think that we're going to even be eligible for it until maybe the summer, with how slowly.
I think it may be later than that. I had my first shot last week, and the next one comes up early in February. But from what I understand, they've stopped vaccinating people in the 1B category because of a deficiency in supply. And if that continues, it sounds to me like the governor and whoever else is involved in this is raiding supplies from certain places and sending them to Louisville and Lexington and Frankfurt and places like that. And, how long is it going to take? Our president says he's going to have 100 million doses out in the first 100 days. Well, that only vaccinates 50 million people.
Well, and I've heard too, through a pharmacist in our county, that part of the problem too is there's not enough staff to give the vaccination. That's an issue.
When I went up there, there were 7 cars in line ahead of me and about 6 or 7 behind me. And within 30 minutes, all those vehicles were sitting in line waiting on their 15-minute rest period to make sure they didn't have any side effects. So, there were 6 or 7 people there taking information. There were a couple people giving shots. So at that particular time in Trimble County, it looked to me like there were plenty of people to give vaccinations and work through the process.
Okay. Well, that's good to hear. So it sounds like we're kind of up in the air about vaccinations, like making it mandatory in order to get paid.
I think right now we can't make it mandatory. There's no reason for it, and there may never be a legitimate reason to be able to do that.
Right.
And we can't make it mandatory for people to have a flu vaccine and all the other vaccines that are out there. So I can't see that this is going to be any different.
But we don't have to pay them sick leave on our dime.
No, that is correct. But the mandatory things, would be the legal technicality.
Yeah.
Okay, so let's roll back to the 80-hour sick leave. Do you want to continue that through June 31st? Okay, let's have a motion on that.
I'll make a motion to extend the emergency paid sick leave through June 30th and reevaluate then.
I'll second.
All in favor?
Aye.
Aye.
Okay, So that is just for the 80 hours of sick leave. Now, I will say that most of our full-time staff members have, they could go if there's extended complications from this 80 hours that they originally get. Most of them have some sick leave that they could handle a few more weeks of sickness. Our part-timers do not. So any like extended illness, that's going to hurt quite a few of our staff members. The other part of this policy was the emergency paid sick leave, or the expanded family and medical leave, which would pay the staff member up to 12 weeks, 2/3 of their pay. Is that something that you think that the library can do, or should we just stick with the 80 hours of sick leave? We do have FMLA in place, but it is not paid.
And the emergency paid sick leave is if they are sick. The expanded family and medical leave is if a family member is sick for an extended period of time.
It could be it could be the worker if they have complications from COVID, but could also mean like a child or a parent or immediate family members. Daycare issues too, I think, also fell within those parameters.
Why would they be around a family member that has COVID?
They
That's
live,
pretty much a direct violation of masks and social distancing, isn't it?
Well, if it was a younger
How do you
child,
care?
What
how
if
do
it's
you-
their child?
they live with them.
Well, yeah, if it's their child, they can't help it.
or-
Mom's got to
Or-
be
or
around her
grandparent.
child. Or, yeah, so,
A grandparent that lives with them.
I mean, I had it all during Christmas, and I have a husband and I have a daughter and son-in-law that live here. So if they had gotten it, they were all supposed to be quarantined the whole time I was, because they would be spreading it.
Yeah, I'm a little bit torn on this one because I know that there is unemployment available for situations like this, but I also know that unemployment is horrible. Just trying to
the
live.
nightmare.
It is very stressful, and it's not enough to sustain a family. So
So when we just made this motion that we were unanimous on, we weren't talking about the whole content of what it says benefits during COVID.
I want to separate this out because I feel like these are like two different policies. So that the first motion I feel like we made was just regarding the 80 hours of sick leave.
Okay.
What is your recommendation? I see the recommendation, or it says your note.
I think if we can financially swing it, yes. We didn't have any reservations back a year, last year, extending this benefit, and no staff member took advantage of it. And I don't see that happening this year either. So I think if we can financially handle it, I would say go ahead and extend that.
Are there, excuse me, are there any particular laws governing the percentage of pay? Like you mentioned the 3/4 pay after a certain length of time.
There is no laws right now that is on the books, and it's 2/3 their pay.
2/3, okay, I'm sorry.
Okay, so we need someone to make a motion on whether we're gonna continue that, correct?
Yes.
So we
I make a
already had-
motion that we leave it like it is until June.
Okay. So put both in place, the 80 hours and the 12 weeks FMLA.
I'll second that.
All in favor?
Aye.
Aye.
That was Pam and Doug.
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 Appreciate that. I know that, we have some single parent homes, and that loss of income would be everything for them. It would be really tough. Okay, let's see, building updates. So my painter called me last week and said, I have time. Can I, I know you need work done. Can I come start working? So he's pretty hard to get scheduled. So I went ahead and put him to work. He gave us an estimate on doing all the caulking and painting trim in the main area and children's room. He said it'd probably be about $1,800, and that seems a little bit high, but if you consider that you have to scrape all the caulking out, recalk it, and sand it, and paint it, it's actually pretty. I think it's a fair estimate with all the trim work that we have in our building. So I would need approval for the estimate of about $1,800. That does not include the cost of paint or other supplies.
I'll make a motion to approve that.
I'll second.
Okay. Okay, Michelle.
All in favor?
Aye.
Aye.
Appreciate that. It's going to look good, guys. I'm excited about it. Zach Lavins came and trimmed some bushes around in the reading garden and the front yard. And they actually resubmitted a quote for $800 to do the fence line. So I think they're going to come in the next day or two to clean that up. So that should look good. Took the outreach vehicle in today for a safety recall on the door latches. And we also did some routine maintenance like oil change, check the tires and all that fun, headlights and fun stuff like that. So that's taken care of for the year or 6 months. E-rate is going pretty well. Dina and Julianne and I, we filed the E-rate form 470, requested bids for internet. Met with Lauren Abner, our E-rate consultant, and she went over the budget for us for next 5 years. And our budget more than doubled. So our budget the last 5-year period was about $32,000. Because we added that Milton branch on, that gave us about $25,000 to spend for that over the next 5 years. And then we had our main branch money too. So it's about $75,000 for E-rate expenses over the next 5 years. So I'm really excited about that. So right before Christmas, I got notified that LibSynergy which is our tech company, they were going to be sold, which caused a lot of panic. And but it looks like the company that's taking them over is called Shelter Blue, and currently they are kind of servicing dental offices and have a pretty good business set up there. So it sounds like they're merging with LibSynergy and they're creating a library division. So we thought it was a good time to reach out to tech companies in our areas to kind of get pricing, since it's been a while since we've done that. So the pricing is as follows. So the pricing is not going to change with Shelter Blue. They said that they would keep the pricing for the next 6 months and provide the same service. And included in that pricing is we would get on-site support and help. 16 hours is worked into that contract amount. Anything outside of that 16 hours would be billed at $90 an hour. And I've been here for 5 years now, and we've never been billed outside of that contract amount, out of that 16 hours. So it works out to be $915 a month. For the month, it's $5,486 roughly. We reached out to ISC out of Louisville to do kind of a cost comparison. This would be, my understanding, it's a month-to-month contract. They do on-site and support and a help desk, but they don't build any hours into the price of the contract. So we would be billed $750 a month and then $125 per hour on top of that for any on-site support or help desk support. So most of the work that they would be doing is just basically make sure that software's updated, servers are working correctly, things are being backed up nightly, that kind of thing. So my recommendation would be to stick with Shelter Blue and LibSynergy and for the next 6 months, and then evaluate the service and just see how they do for the next 6 months to see if they are going to be able to provide the same quality of service that we're used to. I was a little bit concerned with ISC. He wanted to bring the cost down. He was wanting to reconfigure our servers and remap everything to to decrease the amount of servers that they would have to maintain. And I was a little bit uncomfortable with that. So that's why I would recommend Shelter Blue's LibSynergy, even though it looks like it's a little bit more each month.
I'll make a motion that we approve the quote for Shelter Blue LibSynergy.
I'll second.
All in favor?
Aye.
Aye.
Let them know that. All right, so I wrote a grant in November for the computers and to circulate hotspots for workforce grant. And at the time when I wrote the grant, I was hoping that the pandemic would be fizzled out a little bit and more kids would be going back to school, but every one of our hotspots are checked out, and we have a waiting list for 10 people waiting for 10 hotspots. So I don't want to feel bad about pulling hotspots from a student to make available for this workforce grant. So I would like to add 5 more hotspots to the Verizon account, which would be $40 per month per hotspot. We've already received a check for about $3,500, which covers the costs of that service for this year. So that would give us 30 hotspots that we're circulating for the county.
Is that 40 per month per hotspot or total 40 a month?
40 per month per hotspot. So we would add $200 to the bill. That would also roughly include the cost of the management license that would allow us to turn the devices off and track them.
I'll make a motion to approve adding 5 more hotspots to the Verizon account.
A second.
All in favor?
Aye.
Aye.
You guys, I know that bill is awful each month. So I appreciate your support with that. So we're going to start circulating laptops and hotspots February 1st. That should be ready to go. Been meeting with our partners, Kentuckiana Works and the JCTC, and just informing them of this is what we have. Please send people our way, and hopefully that program will be successful. I was hoping that the tax preparation program would also be up and running by February 1st, but we are haven't had a lot of communication with the person that's in charge of that program at the federal level. So we're just waiting on further information from them and the software that we need to download. So I'm not sure if that's going to roll out February 1st or not. So does anybody have any questions about those programs? Okay. As far as statistics are concerned, we're moving along. December is usually a pretty slow month anyway. So, and then with COVID, it's really been slow. For December, we had about 1,173 people walk through the door, which is actually pretty fair considering we were We're just had curbside for 2 weeks. Circulation for the second quarter, we're about a little over 7,000 items circulated. Things are still going out the door, and we're still cleaning and quarantining items. So that's a lot of work, and I appreciate my staff for keeping up with that. Wireless sessions. Let's see, for 2020, of course, they were down for December, had 876 wireless sessions at our main branch, and 153 sessions for our Milton branch. So I wasn't able to get the rest of the statistics out to you guys. I apologize. I'll try to get the other statistics that we usually go over. I was a little bit behind in getting things ready to you guys this time. So any questions or concerns about statistics?
I don't have anything.
Not for me.
So I guess next time for our meeting, be thinking about if you want to attach that stipulation to the COVID pay, the vaccination, if you want to, in order to receive the sick leave, if you want to attach that requirement that you have to be vaccinated. So my brain is a little bit fried right now, and I don't know how I feel about that. So, and I can do some more research on it as well. So.
All right. If we don't have anything else, I'll make a motion to adjourn at 6:14.
I'll second.
A second.
All in favor?
Aye.
Aye.
Aye.